upright. She has no nasal flaring and doesn't appear in any distress. I just checked her pulse and her respiratory rate, which were both within normal limits and regular. She has no intercostal retractions up in here. And can you hold up your hands for me like this at an angle? Perfect. Yep, just like that. Perfect. Her nail angle is, you can put them down. Her nail angle is 160 degrees. Her skin is warm, dry, and intact. And now we're going to go ahead and get started on her respiratory exam. So if you don't mind turning for me so we can get a look at your back here. Excellent. Okay, so we're just going to palpate the back here. Let me know if you have any tenderness. Any tenderness anywhere? Nope. Excellent. Great. Okay. There's no crepitus, no tenderness. We're now going to check her thoracic expansion. So right at T10 here, I'm just going to feel here. And if you can take a nice deep breath in and let it out. Excellent. Great. Okay. So she does have equal movement, which is great. And now what we're going to do is check for tactile fremitus. So what we're going to do is I'm going to take my hands. I'm going to go down your back. I need you to just continue to repeat 99 until I say to stop. Okay?
99,
Mm-hmm.
99, 99, 99, 99, 99, 99.
Excellent.
99.
Great. I'll say it. Perfect. Okay. So with the tactile fremitus, it is normal. It decreases from the apexes to the bases, which is normal. So next what we're going to do, I'm going to have you give yourself a bear hug.
Mm-hmm.
Perfect, just like that. And what we're going to do is we're going to practice percussion, okay? So just going to make sure that there's resonance throughout the lungs, okay? So let's see here. Excellent. Great. So there is resonance throughout the lungs, which is great. You can relax your hands now. So next we're going to check diaphragmatic excursion. So what I'll have you do when I say to, you're going to inhale and exhale, and you're going to hold that breath at that point, okay?
Mm-hmm.
Okay, ready? And exhale. Good. Okay. So we're just going to place a piece of tape here. Good. Okay. And next what you're going to do is you're going to, you can breathe now. And then what I'm going to have you do on the count of 3, you're going to inhale and you're going to hold that breath. Okay? Ready? Inhale. Good. Great. All right. Perfect. Okay. So you can relax and let it out. So we have measured this before. So Catherine has a 4 centimeter range here, which is within normal limits. So that's so I'm going to have you breathe in and out through your mouth once I get started here. So we're going to do left and right sides, and then also the front here. Okay. So ready? Deep breath in. Good. Excellent. All right. And now I'm just going to go to the front here. And again. Good. Excellent. Good. So her lung sounds are clear and all feel. Catherine, you can notice here that her skin is pink. It's warm. There's no cyanosis. Her posture is erect. Her apical pulse that we checked right on her heart here is normal and strong. It was 68, and her blood pressure was 122/76, which is also normal and great. So next what we're going to have you do, you're going to lay down and we're going to check your carotid artery, okay? And for jugular vein distension, that's next. Perfect, okay. So we've got a 30-degree angle here, and looking here, there is no distension noted, which is great. And also what we're going to do is just hold our stethoscope over her artery here. So. right, so there's no jugular vein distension noted. There's also no thrills or bruits noted. It is strong. It's +2 with no variation, which is great. So now I'm going to have you actually lay upwards again. Okay, so now what we're going to do is we're just going to have a feel of your heart here. I'm going to use my back of my knuckles here. So we're going to go right over here, and you can just stay nice and still. Good. We're going to go, you can just tilt back a little bit. We're going to go right in here, here. Good. Okay, perfect. So her aortic, pulmonic, herb, and tricuspid and mitral valves are all normal, no variation, so that's great. Now we're just going to have a listen. So if you can actually sit forward again. Yep, just nice and straight. Perfect. Okay. Actually, going to sit for this. So we're going to use our diaphragm, and we're going to have a listen here. Okay. So what I've noted here is that the S2 is louder at the bottom here. At the tricuspid and mitral valves, it's about equal in the herbs, and S2 rather is louder higher. It was louder in the aortic and pulmonic, and then S1 was louder in the mitral and tricuspid, and about equal in herbs. So next, what we're going to do is I'm going to have you actually lie or sit forward, just like that. Perfect. And we're going to listen again here. Good. Good. So no murmurs noted. There are no other sounds or anything like that, just S1 and S2. And I'm going to have you lie left laterally here on your side. Yep, just like that. Perfect. Okay. I'm going to have another listen. Oops. Okay. Good. Excellent. Okay, great. You can sit up. So again, there were no murmurs noted, no high-pitched sounds or anything like that. Like I said, S2 was louder above here in the aortic and pulmonic, just about equal in herbs, and then S1 was louder in the tricuspid and mitral. So now what we're going to do is we're going to check her pulses. So I'm going to stay on this side, but I would make sure that they are, I would do both sides typically and make sure that they're, equal. So we're going to start up here with her temporal pulse. Temporal pulse is +2 in strong and regular. We're going to go down here to her carotid. Good. Carotid is +2, strong and equal and regular. We're going to check brachial. So if you can pull your sleeve up here a little more. There we go. Okay. Good. Nice and strong brachial. Very good. Now we're going to check radial. You can just relax. Very good. So +2 and strong, regular, and ulnar we're also going to do. Yep. Good. +2 as well, strong. Okay, so now we're going to do, if you can pull up your pant leg here, we're going to check popliteal, dorsalis pedis, and tibial. So right behind the knee here. Excellent. Let me just put this a little lower. There we go. Okay. So right back here, good. Perfect. So popliteal is +2 as well, strong and regular. And we're going to do dorsalis pedis. That's also +2 and strong, regular, and tibial. Excellent. +2 and strong and regular as well. Also, I want to note that the hair distribution is equal.